Today, McCarthy politics were on display with the first get-together of the newly created House Subcommittee on the COVID pandemic, with the likes of Margie Green and Dr. Ronny Jackson leading the charge. And I think you can guess how it went.
I would make the argument right now, right here on TV, that we do more harm than good by treating people with booster shots.
Children truly suffered, and masks were completely child abuse.
What we have now is a complete lack of trust and confidence in the public health sector, complete lack. And that's due to a coordinated spread of misinformation and disinformation that was for political gain for the most part, and a lot of part by public health officials.
Ooh, Lord, Dr. Ronny seems a bit confused about who was providing disinformation for political gain. This clown show was designed to excite the conservative base, but it's part of a real threat to the country, perpetuating the notion that you should mistrust everything you're told by the scientific community. Now, what we do know is that more than 1.1 million Americans have died from COVID since the first confirmed death 3 years ago today. And there's another story out this week that is equally troubling. The Energy Department has assessed with low confidence, meaning the information's credibility is questionable, that the COVID-19 pandemic likely originated from a lab in Wuhan, China, a claim rejected by many in the scientific community early on. And tonight, FBI Director Christopher Wray says the FBI is in agreement.
So, as you note, Brett, the FBI has for quite some time now assessed that the origins of the pandemic are most likely a potential lab incident in Wuhan.
Now, keep in mind, other intelligence agencies still hold to their contention that it was likely the result of a natural transmission from an animal. But the reality is, for a long time, we were told that the lab leak theory was not a legitimate avenue of inquiry. And now we're finding out it just might be. So what are we to think? This is not to say that our scientific community is trying to pull one over on us like some on the right would have you believe. COVID-19 was a novel virus, never seen before. Our country's scientists did what they're trained to do, make assessments based on the information available and reassess as more information is provided. But the problem is that all of this has become so politicized and exploited by the right that when any new assessments are made, it's presented as proof that everything previously said by our scientific leaders was all lies. It comes at a time when we need to have trust in the science even more, because the next pandemic could be coming. Joining me now is Dr. Kavita Patel, former Obama White House policy director and an MSNBC medical contributor. And, you know, the challenge we have, Dr. Patel, is that right now, the confidence that people have, you know, in the science, in the medical community, this is a Morning Consult poll. How much do you trust the CDC? A lot or some was 67%, not bad, not much, 1/3. The White House, 52%, not much, not at all. NIH, 36%. And then Morning Consult also asked, how much do you trust public health institutions to manage a future pandemic? Not bad, a lot, 55%, but there's still a good third of the country that seems to not trust the science at all. And I think we can guess which third that is. How dangerous in that environment is it for us to even talk about, which we should be able to talk about, this theory about the lab leak?
Yeah, Joy, it's unfortunate because for decades we've been calling, and when I say we, scientists, clinicians, laboratory regulation experts have been calling for better kind of standardization, oversight, and honestly, resources. Joy, we have a number of countries that are under-resourced for just basic lab provisions. So I think that all of this is leading to what is amounted to some sort of government conspiracy by, you know, Biden officials to cover up some sort of lab leak. This is the truth. We will likely never come to some definitive conclusion about what happened. We know that the Wuhan market was a super spreader event. Was that the result of a natural spillover from animals to humans? Was it a lab leak? Was it something even horrible to consider, which is something intentional and bioengineered to create this much death and havoc? All of those possibilities will likely remain in people's minds because we're just not going to have 100%. But to your point, we have reached such skepticism that could you imagine going to Congress and saying, you know what, even if a lab leak is plausible, what can we do to move forward? We're all still stuck in pause to just point fingers and blame each other instead of moving forward. By the way, that includes me accepting that there were things I got wrong. There were things that everybody could probably say we could have done better. But the current dialogue does not allow for that humility or for an ability to move forward.